Well, it looks like an unwanted companion is going to rear its ugly head again. Not quite sure how extreme it's going to be, but some of the health officials out there are saying we might see another summer COVID wave. It's like the old saying, just when you thought it was safe to go back in the water, here comes COVID again. And to get some more on this, I am grateful to be joined by Dr. Pavitra Roychoudury from UW Medicine. Doctor, thanks. I appreciate it. And I want to start by asking you, what you're seeing and hearing in terms of COVID activity. As I understand it, it's more sort of a national wave, but what can you tell us about, in your professional circles, what the word is?
Yeah, so what we're hearing is that there's an increase in COVID cases in multiple parts of the country, particularly in the Southeast. There's been a rise in cases, and the rise has also been associated with an increased proportion of cases due to a subvariant called EG5. So that's what we've been hearing. We haven't seen a huge rise in cases in our region just yet, but we are starting to see levels of SARS-CoV-2 go up in wastewater for our region, and that's usually an indicator that a rise in cases is going to come in the next few weeks or so.
So when you say next few weeks, we're talking coming soon. Just as the kids are going back to school, we're all doing summer travel. How much does that, since I brought that up, how much does that play into this?
So, in previous summers, we have seen a rise in cases. So last summer, we had a sort of smaller wave, not quite the large wave that we see in the wintertime, but we did see a rise in cases in the summertime around July. So cases in the summer is not unexpected. There's a lot of gatherings and there's a lot of travel going on. And also on top of that, a lot of us are several months out from our last COVID shot or last infection potentially. So there could be the impact of a little bit of that waning immunity that this all put together is playing together to lead to this rise in cases, and add to that a slightly more transmissible variant, and that might explain why we're seeing this rise in cases right now. That being said, it's not anywhere close to some of the previous large surges that we've seen. So I don't think that there's any reason to panic just yet, but it's just something that we are keeping our eyes on and kind of preparing ourselves in terms of, in our lab and in testing and sequencing capabilities to make sure we stay on top of the variants that are circulating right now.
Now, you mentioned that EG5 is more transmissible. Do we have an idea of how, and this is really a broad brush I'm trying to get you to paint, but how, when people are sickened by it, how severe the disease is with EG5?
So potentially EG5 is more transmissible. I don't know that we know that for certain just yet. The reason we think it's more transmissible is that it has kind of slightly nudged the other circulating subvariants to take over as the dominant lineage in some parts of the country. So that is what tells us that it could have some sort of transmission advantage. But, that takes time for us to see in multiple regions and know for sure and, have enough data to put actual numbers on those. And I'm sure we'll hear about that in pretty soon.
Have we seen, though, how severe the disease is that it produces?
We don't know for sure that it's causing more severe disease. There is a slight uptick in hospitalizations in the US, as reported by the CDC's tracker, but we don't know for certain that it is due to this variant in particular. So yeah, I think it's still too soon to say.
Even still, though, we're still seeing some, albeit a smaller number, hospitalizations and people getting pretty sick from COVID, despite,
Yeah.
everybody's feeling that the pandemic is over.
This is correct. Yes. So the number of hospitalizations is slightly on the rise. It's again not anywhere close to some of the prior waves, but that sign is just something that tells all of us to just kind of keep an eye on these numbers and assess individual risk, as well as just kind of get ready in case there is a wave to come.
And I would guess that the recommendation is, I it's another one of the usuals at this point. It's almost become routine. Get up to date on your shots and wear a mask if you feel you need extra protection, right?
Yeah, exactly. I think all of us have all the tools at our disposal now. We have masks that we can use in very crowded indoor settings. Get vaccinated. Also, avoid super crowded settings if you want to avoid getting ill, and use antigen tests if they're available, or seek PCR testing, and then if infected, don't go into work or go into gatherings, and try to ensure that infection stops with you.
As somebody whose mother is immunocompromised, that's an important message, because she talks about she has to regularly go to the hospital for different things, and she sees people just wandering through the halls with no masks on anymore, and there are certain settings like that I would personally like to think that people would take care for those who are in need. Now, we've talked about the vaccines just briefly, and it might be too soon to ask you this question, but do we know how well the vaccines, especially with the bivalent booster, how effective they've been against EG5? I know here in Washington, the state says XBB 1.5 is still sort of leading the way. How would you say, in terms of efficacy, the vaccines are holding up?
Yeah, so it's too soon to say what the efficacy will be against a particular sublineage like this EG5. I think the fact that we haven't seen a huge dramatic wave of hospitalizations or deaths in the most recent winter surge seems to suggest that protection from the vaccines, as well as from people who had a recent infection, put together, that immune protection has been helpful in kind of reducing the severity of the previous surge. That being said, we're all about like 8 months out from that time, so there's going to be some level of waning that's going to occur, and but that being said, there's also the new round of vaccines that will be announced hopefully pretty soon. So once announced, if eligible, I would recommend that we get it.
Okay, so you said that to a reporter. You dropped a little carrot there for me. You said there's an announcement coming, but what do you know about the next round? These, what you say is the new round of vaccines. I'm assuming there's some updating to the formula.
I mean, there's been discussions about updating the vaccines. I think we haven't heard for sure what is, when that rollout is going to happen and what the exact formulation will be, but there have been discussions about updating it before the next season of the respiratory virus season comes.
See, now you also made another good point in terms of how long it's been since most of us have had that. I mean, I personally, the last shot I got, and I've got 5 of them in me. I'm pretty proud of that, actually, that I've managed to get through all of them, because a couple of them had made me, pretty ill for a couple of days. But worth it, definitely worth it. I feel like it tells me it's working. But I got my bivalent booster in November, and that's the last shot I got. What do you think? I mean, should we still be getting them every 6 months, or are we okay just getting them ahead of the winter? I mean, what's the current school of thought?
I think it's best to talk to your healthcare provider about this, because it also depends on on people's age, their whether they're immunocompromised, their medical history, and so on and so forth. There's a number of factors to be taken into consideration, and then based on what our age group and is eligible for, just go with the healthcare recommendation for that. It would be my my advice.
Now, I am certainly no medical expert, although all of you who are experts have taught me a ton in the last 3 years, and for that I am immensely grateful. But I sort of get the feeling like, it's almost like the flu shot, that maybe we do it once a year, maybe we're to that point. But then as soon as I think that, here we go again talking about another summer COVID wave 8 months out with the waning immunity. So it really, like, I get that it's hard to say. But with all of that in mind, what else do you think we should be thinking about as we see the activity increase?
Yeah, I would keep an eye on local numbers. Think about what COVID numbers are looking like in our region. I know that's tricky because there isn't a lot of test data available that tells us how many cases are in the region, but we can, keep an eye on wastewater numbers and other measures of circulating COVID, and also look at hospitalization numbers in our region, and then use that along with our assessment of our individual risk in terms of our health status to make decisions about whether to go for that, very crowded indoor gathering, or, wearing masks on in a crowded airport or public transit, and so on and so forth. I think that would be my recommendation.
Okay. Well, as a guy who's taken the kids to Disneyland in October, great timing on my part. Glad I thought that one through. I didn't even think about COVID when I was making those reservations, and I won't tell you the amount of money I dropped on it just before we've even left Seattle. But no, that's excellent advice. And for the record, too, I also looked at the state dashboard, and in terms of county by county, most of the state is pretty well below, in their 7-day case rate, below 50 per 100,000 people. Garfield County in Southeast Washington is an exception. It's at about 90 per 100,000 people over several days. But that's far away from where we are. So even though people move, I think the big takeaway is that COVID is still out there, and it's something we need to be mindful of. Wouldn't you agree, Doctor?
Absolutely. COVID is still out there. And let's not forget, we also have influenza and RSV. And all three of these could co-circulate in the fall. So, taking all these measures, we know that masking is helpful in preventing the spread of infection. So using those in crowded settings, getting vaccinated as soon as that's available to us, and, in general, preventing the spread beyond ourselves. I think that will help us stay on top of these three viruses this season.
Good advice. UW Medicine's Dr. Pavitra Roychoudury. Appreciate that, Doctor.
Thank you. Thanks for talking to me.